Dr. Malpani, you know, you're a doctor. We are living specifically when it comes to healthcare, and I know it well because that's one area that I've been working on. Uh, in the last 1 year, I think I've interviewed about 70 to 80 very well known doctors, including you. And one thing that has come out very strongly is a change that has happened over the last 3 decades. There was a time in India we would treat our doctors as God, with full faith कि जो उन्होंने बोल दिया सर आंखों पे हम वही करेंगे क्योंकि उन्होंने बोल दिया है. That relationship is under stress today. Today, when we go to a doctor, we go with a suspicion ये पैसा कमाने के लिए मेरे को बोल रहे हैं ऑपरेशन करना है या genuinely मेरे को जरूरत है. And the question when we look at reference is that can you suggest a genuine doctor? Right? That's the question that we ask for. Earlier, it used to be, do you know a doctor that I could go to? Now, with this much of distrust in the healthcare system, there are doctors who do the right thing. There are doctors who genuinely feel for the patient. Do you think that having a spiritual mindset can help bring back that trust in the healthcare system?
You're absolutely right, Harvinder. Once it was a noble profession, and today it is no more. Today, unfortunately, medical ethics are out, malpractices are rampant, and people even doctors don't want to follow the rules that are set. So absolutely, it's become a very, very difficult thing now. Even for us to practice, it's becoming difficult. In fact, let me tell you something. Half my consulting is not about what you ought to do, because people have already gone on the net. They know what they want. Especially, I'm an infertility specialist. So they are shopping around. They've been to several doctors. They come to me after doing 6, 7 IVFs. They know what is IVF. And they are looking up the net, or the other doctors have cheated them or probably done the wrong things. There are new technologies every single day. It's a very, very rapidly advancing science. I mean, the test tube baby, Louis Vuitton, was found 40 years ago. But almost every day there's a new technique. I mean, you heard Swami Mukananda, he mentioned a few. There's PGD, which is prenatal genetic diagnosis. There is stem cell therapy. There are loads of therapies, loads of intervention. And half my time I'm trying to tell them, hey, this is not good enough. This is yet not come up. So don't do this treatment. It is very, very difficult now to tell patients, because I know that either they think I'm a crackpot or they think that this doctor is not good enough, and they just go to the neighboring doctor, and who would do them. Let me give you a classic example of let's say surrogacy, which you all know. Surrogacy has become a common word. Now, I have done my first surrogacy case probably in 95 or 96. It was a genuine case where the patient did not have a uterus, but nobody knew about it. And we were doing it as a part of IVF treatment or a reproductive treatment. But today, with the Bollywood stars coming up, practically every Hollywood star has had surrogacy. And today we have women just coming and say, doctor, oh, I don't want to go through the pregnancy. I don't want to do this. I don't want to be going through the delivery pains, and just do surrogacy. And I have a hard time telling them and teaching them, oh, motherhood is the best thing that can happen. Part of motherhood is going through pregnancy, breastfeeding. And again, they think this is an old, typical auntie, mentality. And of course, they don't do it. It's becoming harder and harder. So how do we do it? I think that our value system as we were growing up, the values, the principles that were taught by my parents, by my teachers. And now, as I grow, reading all the spiritual scriptures, I'm trying to read the Bhagavad Gita, the Upanishads, I'm trying to read. And then you realize that if you follow those, if you follow the right path, and how do you do it? I think for me, it's my passion. I've been very, very passionate about being an IVF doctor right since my residency days. And I realized when I was a resident in KM, this is what I did, want to do. So I went abroad, I packed the technology. I could have very well stayed abroad. I didn't do that. came back. And I have a magical profession. I mean, I would say even a spiritual one, because we create life every single day in my lab. We grow babies. You know, when we were young, I didn't realize it. I mean, it was more technical. Oh, okay, we're adding the egg and the sperm, we're creating a zygote. Wow, wow, wow. And today I say, oh my God, this is what is spirituality. It is a spiritual experience. You know, the main question is, what is life? How does it exist? Who am I? When does life begin? I know these are very difficult questions to answer, complex issues, and we have stalwarts out here who would give you probably better answers. But scientifically, it has been proven that life begins when the sperm fertilizes the egg. And that's what we see today. And I'm yet getting excited, though I'm doing it for 33 years. I get excited when I see that embryo growing in the lab from 2 cells, 4 cells to a ball of cells, millions of cells. And passion keeps me growing. And if you want to do something and if you're good at it, I mean, if you have a passion, I think you're automatically good at it. If you're good at it, success comes, fame comes, money comes. And without realizing, we just went on working without looking at the fruits. And that is exactly what Bhagavad Gita teaches you. That is what this says. Do not look at the result. Just keep on working. And that is what is Karma Yoga today. And I think we've just followed these simple principles without looking here and there. It's very, very hard because, you know, in a society, you know, you want, you know, to work without wanting that money or the glory or the awards. We are basically ostracized half the time. You know, people will not call you for a conference because you call them for a conference, they call you. You know, it works that way. But I think if you concentrate on your work, and that's what we've always followed, until today, I think it's worked very well. So I think, you know, you just follow the right path. I think you have it all.
Right. Dr. Malpani, same question. You know, the context is, आपने जब बताया था, when you were talking about that, you know, the process of a birth taking inside the womb and the journey of motherhood is, I think, the most pious spiritual journey that could be there, because that's the only relationship, I think, is when, without putting too much of thought in your mind, by default, your state of mind is of giving. आप अपने बच्चे के लिए नेचुरली कुछ ना कुछ करते रहते हैं विदाउट थिंकिंग उसका रिजल्ट क्या होगा, मेरे को कुछ मिलेगा नहीं मिलेगा. So what are the kind of tools that you may have used or insights from your own experience which you feel have helped you in doing what you're doing better than anyone else who may not have had that same mindset?
So I'm an infertility specialist, like I said, and I deal with infertile couples. So infertility is just not a medical problem. It's very much a social, very much a psychological, emotional one. So what you need to remember is to do a holistic treatment for these people. And that itself, I think, helps. Because instead of maybe just doing a sonography, just operating, you know, you spend so much time counseling the patient, the time that you spend. And me versus other doctors, that's what I tell them, that it's not important, that putting that embryo is not important. All the other doctors can do it. But what is different? It's the time that we give them, the time just listening to the patient, empathy, compassion. And again, all these are important in spirituality. This is what we teach people. This is what everybody's taught. This is what we've done. I spent hours talking to the patient up to a point that my staff gets fed up and says, look, we need to go home. And there I'm just talking to them about it. So that, I think, is spiritual care, or spirituality comes in there. Now, another aspect of spirituality, just trying to say, is knowledge. I think everybody says, like Vedanta, Bhagavad Gita, they all say, learn, you know, get knowledge, impart knowledge, and get the inner wisdom. And I think we spend a lot of time empowering our patients. Patient education is a very, very important aspect for us. And we want patients to be intelligent, to be informed patients, so they can do their right treatment. We have a very comprehensive website. I've written books. In fact, I've just written a book called Tries, Sighs, and Lullabies. which speaks on the social and emotional angle of infertility. We have a website which answers questions. We have blogs, we have YouTube videos, we answer emails and WhatsApp for free. But that's what we're trying to educate. It's not come to us, but know what you're doing. Do not get cheated. Infertility patients are very gullible. They're very, very naive, and they would do anything because they're so desperate for a baby. You tell them to stand on your head, in fun, I say, doctor, what can I do? And I say, okay, go stand on your head every day. And, there are patients who literally do that, I would
But that's
say.
actually pretty good for infertility.
Yeah. I wish it was so easy, I would probably have you come in every day. Yeah, but I wish it was so easy. And
That's the thing, it is easy, but people don't do yoga.
So that's, that is what we teach them. I use spiritualism, in fact. Again, our results. The result is not 100% with the best of the treatment, with the best of the embryo, best of the clinic and doctors. The results are just about 35 to 40% per cycle, which means every time we put an embryo, the chances are only 40%. And there are doctors who would fool them and say it's 80%, 90%. Yes, but that's not true. So 60% are IVF failures. And that is what we teach the patient, along with giving them a ray of hope, teaching them faith in themselves, faith in God, faith in the doctor. We tell them to be realistic and to say, hey, look, there are only certain answers that we can answer. With anything, there is something beyond our science. And that teaches us doctors to be humble too. That even with the best, do you think, you're God at times, because people really touch your feet and say, oh my God, you're like God. And I say, no, that's not what I want. But, sometimes you think when you get a good rate, but that teaches you to be humble. That teaches you the spirituality, tells you that, yes, there's a higher divine power sometime, somewhere behind, where even with the best of the things, they don't get pregnant. So I think that really teaches them. And I do encourage spirituality or spiritualism. When I'm doing a transfer, I tell them, go ahead, you can say your prayers, you can chant. Very often they're chanting Gayatri mantras, Naukar mantras, they do whatever. So we encourage them to do meditation, yoga, whatever they feel. And we do encourage spiritualism. So I think in my practice, I use a lot of spirituality.
I think, and I want to ask you, Dr. Malpani, Ira, Ranveer, that, Sister Gently just said that, children observe their parents and then inculcate those values in their life without knowing it, without making any efforts. We have seen spirituality, or at least consciousness, as what Ira mentioned, help us differentiate how we do what we do from others who do the same thing, but we do it differently because of our inner consciousness, mindfulness. If we have seen it work for us, do we not have the responsibility to share this knowledge and experience with those who are upcoming in the similar profession, to help more and more people do the same profession with the same values that you have seen work and make a difference? Brief answers, starting with you, Dr. Malpani.
You're absolutely right. Just like children observe and do it, I think we are all aware. I think at least we are all aware and conscious. And if we are seeing something being done wrong, I think it's better not to keep quiet and better to tell them that, hey, look, this is not the right way of doing it. And they will observe you. But the point is, they have to see you, right? I mean, I cannot go there and say, hey, look, I'm good, I'm doing this, and you do it. So in my profession, at least, it becomes very, very hard to teach doctors because each one thinks they're the best. So that is hard. But yes, like I said, we're into patient education. We are also into educating doctors. And we do have certain, where my husband writes blogs, I write a few things where we are trying to educate the doctors to do the right thing and to be aware. I think that's a very, very important word, is to be aware not only of yourself, to be aware of the patient's needs. In my profession, I think the patient is to be treated like God, and they need to be treated with respect.